officer working with the Sickle Cell Foundation Nigeria in Idiaraba, Surulere. He finished and graduated at the College of Medicine, University of Lagos in 1977 and proceeded later to the United States of America for the postgraduate course. He worked for the Lagos State Health Service Commission at the Pediatric Department of various hospitals, Massey Street Children's Hospital, Ekpe General Hospital, and Onikon Health Center till he retired in May 2016 and then joined the Sickle Cell Foundation Nigeria. As a pioneer founder of the pediatric sickle cell clinic of Ekpe General Hospital in 1992, and also a pioneer founder of the Sickle Cell Clinic of Onikon Health Center in Lagos. Also a trained genetic counselor in sickle cell disorder. It's a pleasure to have you back in the studio this Saturday.
Nice to have you.
Good morning.
Thank
Happy
you.
New Month.
Happy New Month to you.
All right, so today we're going to be talking about trigger factors of crisis in the sickle cell disorder. That's what we're talking about today. So what are the trigger factors?
Thank you. The first thing we need to know before we really delve into the trigger factors,
All right.
the first thing we ought to know is that the body itself has what I might call intrinsic ability
Okay.
to cope with all kind of negative things impinging on it.
All right.
There are many factors, many negative things assaulting the body.
Okay.
But thank God, the body has some ability to cope with many of them,
Okay.
so that the natural homeostasis of the body is not disturbed.
Okay.
Because if it is disturbed, the body will succumb to many bad things. It may lead to death, things like that.
Yeah.
So it's like God Almighty has put into the body certain mechanisms, certain abilities to cope with all the negative things that are assaulting the body.
Okay.
Some of this ability is inborn, intrinsic, genetic. It's there right from birth.
Yeah.
Some of them you acquire it later on. We call them acquired immunity.
Acquired immunity.
You acquire it later.
Okay.
Some is just inborn immunity
Okay.
against all the negative assaults.
Okay.
The thing is that it varies from person to person. This immunity, this ability to resist all this negative, it varies from person to person. And that probably explains why some patients with sickle cell disease, they go through life without much problem.
They don't have as much crisis as...
Yes.
All right.
They have strong ability, strong immunity, either acquired
To fight off infection.
To fight off infection.
Okay.
But some, their own ability is a bit weak. And that's why you see some sicklers from time to time.
That's why they are prone to
crisis, hospitalization. Sometimes you find twins. I've seen a case, twins, two girls, by a mother, by a parent, two girls. They have both of them have sickle cell anemia.
Okay.
And one of the two girls is always coming to the hospital almost every month. Admission, blood, crisis. But the other one is virtually free. So how do you explain that? They live in the same place. It's not as though one is staying at Ajegule, one is staying at Banana Island. They stay in the same place. They are born by the same parents. They go to the same school. They have the same. One is always in trouble. The other is not.
And it's not as a result of what one of the others is doing. Maybe she's doing something wrong.
No.
Okay.
So that's what I'm telling you, that it varies from person to person.
Okay.
It depends on the immunity you have. Some are weak, some are strong. So now, with that as a background, we now know why in some cases you have many complications of sickle cell disease itself.
Yeah.
There are many complications. Some can resist them, but some people with a little trigger factor, they go to serious complication. So we start by saying that, number one, trigger factors are things that impinge from the outside on the body.
Okay.
That tend to put the body to put it off balance, so to say.
Okay.
Talking about the different trigger factors, the most important one, but all are important, is infection. Sickle cell patients, they don't like infections. Little infections can knock them off. Especially even a young child, 1 year old, 2 years old. infection is the number one killer of many sickle cell patients, even at that small age.
Tender age, yeah.
Yeah, infection. And the two most commonest infections are number one, malaria. Nigeria.
Well, how do you cope with that in the kind of environment that we live in?
We cope with it, number one, once you've recognized that this is a sickle cell anemia patient, you start even from infancy, even before 1 year old, to give anti-malaria. We have different kinds of anti-malaria drugs to prevent malaria. You make sure that there's not much contact with mosquitoes. We have mosquito-treated nets now, which is given out free in most
that you can do within the house. But when the child goes to school and goes outside the house,
well, that one is a bit difficult to prevent mosquitoes from biting outside the home.
Yes.
But that's why you need to give anti-malaria routine drugs on a daily basis. So we give that to treat malaria.
Okay.
The second kind of infection that we have are the bacterial infections, and there are many of them. And so luckily again in the hospital we have some drugs we give. We have some antibiotics we give for the pneumococcal infection. We now have some vaccines that the federal government itself says all children, not only sick, all children must have these vaccines to prevent pneumococcal infection.
Okay.
Because pneumococcal is the worst infection that a sickle cell patient can have. It's a bad bacterial infection. In fact, it's worse than measles, all this kind of thing.
Is it for those who are prone to crisis, or the ones that are still strong enough to fight infection?
They too can have pneumococcal infection.
Oh wow!
And that's why in the hospital today, especially with our sickle cell clinic, we put them on regular vaccine against pneumococcal infection.
Okay.
We call it Prevena injection.
Okay.
So with infection, we think of the pneumonia is the worst infection. We think of malaria. That's the second thing. Now, another thing that's like a trigger factor is dehydration.
Yes, we talked about that before, dehydration.
Dehydration.
Especially this weather, the Hamilton weather now.
Dehydration. In other words, when there's not enough fluid in the body of a sickle cell patient, that can be a danger thing. You can imagine somebody having stooling and vomiting, stooling and vomiting, stooling, and he's not given
he's not refueling his body.
Refilling. Within a short time the person is dehydrated, and that can have very bad effect on the patient, because with dehydration what's going to happen is that the blood in the body is going to be moving sluggishly. There's not enough water
to let it flow very well to the heart.
Sluggishly, and when it moves sluggishly it tends to clump together.
And that means some parts of the body
will not have
deprived of,
So those ones are like crying for blood, crying for oxygen. Blood contains oxygen, carries the oxygen, carries the nutrition. So they go into pain crisis. So dehydration is so important. Another thing that is like a trigger factor is stress. Stress of all kinds: physical stress, emotional stress, mental stress. You can imagine a sickle cell patient in the school, and they are succumbing him to running and jogging like other children. Within a day or two, that child will go into crisis. That's another trigger factor. Emotional stress, like a student is like overstretching himself. In the time that they resume school, he's not reading like other children, and when the exam is just 2 days ahead, he wants to read everything in 2 days. 10 o'clock in the night, he's still reading. And mommy is saying, John, what are you doing? Everybody has gone to bed. And John is saying, mommy, I still have a lot of things to do. Within a short time, that John will go into crisis. So you can see that mental stress, physical stress, any kind of stress is like a trigger factor into destabilizing the patient. Injury is another trigger factor. Children play a lot, and there's nothing wrong with that. In fact, they should play. But sometimes they overplay and they have injuries. And when the injury is not well treated, it can precipitate crisis.
All right. If you're just tuning in, you're listening to Surviving Sickle Cell, and we have Dr. Tunji Alakija. And today we're talking about trigger factors of crisis in sickle cell disorder. If you have a question, You can call the number 0700 923 923 923. Again, 0700 923 923 923. Or you can send your messages to the WhatsApp number, which is 0817 313 6193. So, what are the other factors and how can you prevent?
Okay, we'll get to that very
All
soon.
right.
Malnutrition is another trigger factor. In other words, what we are saying is that if two children, for instance, with sickle cell anemia, let's say child number 1,
Yes.
child number 2, one is well fed, even though there may be negative factors from the outside, it's very unlikely that that child will succumb to crisis or get sick and that kind of thing.
Okay.
But a child that is not well fed, the mother is not giving the child good food. The mother is maybe just giving gari with a head of dry fish.
But what about if the parents do not have the means to take care of the children? If they live in an environment in which they don't have control over, for kids who live in Ajegule, for kids who live in Mushi, how do they cope? That's where they can afford to live. But unfortunately, the environment isn't clean enough, and personal hygiene is 0 to. So how do they properly care for that child?
I think the first thing is that the fathers must know that the child needs good food and good environment. They'll do the best they can. They have to budget the money for the children's food to be on a high level. Most of these mothers, when they go to function and parties, they spend a lot of money, like you know. You are a woman yourself.
Yeah.
So what I'm trying to say is that Ashwebi
should be cut down to the barest minimum.
You should know that the child being a sickler again, you know, he's already having problem being a sickler, and then you are not giving good food, and the child is looking like bonga fish with all this with the oh God! Within a short time, that child will go into crisis, and by the time you bring the child to some of our hospitals, we have to admit, we have to put on special nutrition diet, we have to put all this kind of thing. So I think that is a problem. Maybe the government can come in and
assist the parents that can afford
and assist
to.
those who can just not afford, those on poverty level. I think they deserve something. I think we have to have some advocacy on that.
All right.
And then another trigger factor that we need to take care of is extremes of temperatures. Cold, too much heat, it can be a problem. Last December in Nigeria, Harmattan, November, December,
it got really cold.
It got cold, and not only because it is cold. With this cold weather, you have a lot of infections of the air, respiratory infections.
Yes.
So it's a double trigger factor. The cold itself is not good. So when it is very cold, we advocate wear warm things for the child. When the weather is very warm, wear cold things. Put off many things and let the child be cold. You know what I mean? If it is very, very warm, let the child be opposite,
yes.
And if it is very, very cold, that can be a trigger factor. So once the mothers know this, you see, knowledge is power. Most of the things we've discussed, many mothers don't know. And I'm glad for this forum, this platform, that we are letting them know all the things that can impinge negatively on the child and let them go into crisis and complication, which we'll talk about now.
No. So would you say wearing a face mask is a bit extreme? Because kids who take public transport, people coughing, in their face and sneezing and all of that, do you think it's okay for them to wear a mask, or that's a bit too extreme to protect themselves from the, the infection?
If it is recognized as a possible source of real infection, it may help. If it's, but in most cases you don't find so many people coughing serious. And if somebody is coughing beside you, move to another place. It's not likely that almost everybody in a bus is coughing, maybe one person. So if you are seated beside that person, move to another place.
All right. All right, so let's go to how to protect yourself.
Okay. Now, we'll do that along with naming the various complications.
All right.
Because all these trigger factors, they want to present, let the sickle cell patient have some problem, complications, problem.
Okay. All right.
One of the worst complications is stroke. Well, most of us know stroke in adults, those who have hypertension.
But it can also affect a child?
Oh, yes.
Oh, wow.
Many people, when we talk of stroke, they are thinking of elderly people.
An elderly person, probably 40 and above.
Yeah, 40, who has stroke, he can't walk,
Or one part of his
one part
body
of
is paralyzed.
In children, even 2, 3 years, 4 years, 5 years.
Wow.
In children with sickle cell. So some of these mothers, they've seen it in their children anyway. We that take care of them, they bring them to us. The child cannot walk, the hand is paralyzed or weak, and the face is weak. So it's one of the complications of sickle cell disorder, SCD, and it can come up when some of these trigger factors are operating and you do nothing about them. So the important thing is, number one, to prevent that one. Make sure that all these trigger factors we've talked about doesn't prevail with your child.
Okay.
Number two, go to a nearest hospital and make sure that all the things that for instance, stroke, for instance, we can know which child may have stroke and start prevention quickly.
Oh, you can tell.
We can tell.
How can you do that? How can
There
you
is
tell?
something we call brain scan.
Okay.
We call it TCD, transcranial Doppler. It's a brain scan.
Okay.
We do it for all children between the age of 2 years and 16 years. Well, we ask them to come. We do it at least once a year. When you subject that child to this brain scan, from the result, we will know which of those children
is likely to have
stroke, and then we start them on some medication to prevent it. Some will come with a good result. Let me say good result, and that one means that no possibility of a stroke. Everything,
at all.
the blood is flowing well.
Okay.
But in some cases, the result shows that the blood is flowing too fast. We call it high risk.
Okay.
High risk. Those ones, we put them on some medication, hydroxyurea. We put them on, which tends to knock off the possibility of stroke. So for stroke, no child will have stroke. Mothers, we've talked about all the various trigger factors. Mothers, we've asked you to bring your children to the school, mothers and fathers to the hospital, and then we'll give the child some medications that will help them. Another thing that can happen is we call it acute chest syndrome.
Okay.
Acute chest syndrome is like pneumonia, but it's severe. The child is coughing, he's having fever, he's having difficulty in breathing. That one sometimes, in fact many times, an acute emergency that needs to be hospitalized. Mothers, fathers, don't keep that child in the home and say you are giving cough syrup. It's not cough syrup you need. Bring the child to the hospital quickly. Once we diagnose it, we start medication and hopefully the child will be okay. Another complication that can come because of these trigger factors is leg ulcers. Many patients, well, let me say 10 to 15% of sickle cell patients, especially the teenagers, they will have leg ulcers. Ulcer is like a wound, and most of the time it's in the lower leg.
Yes.
And it doesn't heal. You apply all the medications, all the dressing, all the antibiotics, it doesn't normally heal. And some of them that do heal, within a short time they break down again.
Wow.
So it becomes a chronic thing. And then the child is limping, he's having pain. He can't go to school, which is very important. It disturbs the schooling of the child. And then it costs a lot of money sometimes to be coming like every day or every other day for dressing. It's quite expensive. So we need to get to a point where sometimes you may have to do an operation. In other words, you do what we call a skin graft. You take skin from another
part of the body
and place it on the
to cover up the.
But many times within a short time it breaks down again.
Wow.
So, but thank God we have a cream now that seems to be very effective.
Okay.
In the good old days, we've used honey and cream. We've used Usol solution. We've used hydrogen peroxide. We've used all kind of things. They don't work too much. But these days, we now have one we call Asmisol.
Okay.
It tends to work very well. Asmisol, ASMISOL. It works very well. It's like a creamy kind of solution.
Okay.
We use it in many times in our Sickle Cell Foundation, but it's out of stock for about 2 years now. So we don't have it now. I'm told that it is manufactured and produced by a company in Ghana. So if somebody is in that category, link up with us at the Sickle Cell Foundation or any other hospital.
Where are you located? Where are you located if they want to ask more questions and come to you after?
Idiaraba is directly opposite LUT.
Okay.
Lagos University Teaching Hospital is on the right. Our Sickle Cell Foundation is on the left. Directly on the left.
Okay.
As we saw, is good. So leg ulcer, in fact, there was a lady, about 20-something-year-old lady. She's been suffering from this leg ulcer and it disturbs her so much. She's crying. She was crying in my presence. And the mother was trying to be hard on her, and I said, "Mother, don't be hard on her. I know what she's going through." She said it has disturbed her schooling so much. Because the more you walk,
You're
the
more
worse.
pain, yeah,
The
you're
worse
in.
it is. Better to be resting the leg also. But how long will you rest in the home when the school is there?
Because you have to go out.
So this is another thing. Another complication that we sometimes see is what we call avascular necrosis of the head of the femur. In other words, the femur is the leg bone that supports us. Sometimes because the blood is not flowing well to the hip joint,
You start having hip pain.
The heart's having problem with the hip joint. Blood is not going there, so it begins to die, so to say. And with death of the joint there, infection comes in again. It becomes shorter than the other leg. Then the child is limping and is in pain. It can be quite a big problem. Big problem. In the end of it, we may ask the child to go for hip replacement operation. We don't do it at the foundation, of course.
But sometimes it can get that bad where the child will have to get a hip replacement surgery.
Yes. At Igbobi, for instance, at the National Orthopedic Hospital, they do a hip replacement surgery there. But then it depends on whether they have prosthetics. The replacement
for it.
They may have, they may not have. And then again, even after doing the operation, it lasts for only about 5 to 6 years. After 5 to 6 years, you have to do another one. Because it's like that's the lifespan
of it.
And by the time you do 2 operations, we don't advise a 3rd or a 4th for some technical reason. So it means that the patient will be free of the pain and everything for like 12 years.
And then you're back at it again.
And back again. And then we don't do it even for people, younger children. They have to be at the age of maybe from 16 when the bone is not growing much again before you do it. So you can do 2 times. Each one lasts for about 7 years. You can't do it more. But at least for 14 years,
you'll be free from the pain.
So that's the importance of recognizing trigger factors and making sure it doesn't operate.
All right, we are completely out of time. We have to go. We'll be back same time next week. Next week Saturday from 11:30 to 12 here. You can also go to the Sickle Cell Foundation. He described where it is right opposite Luz on the right, and it's on the left at Idiaraba. If you have further questions and to want to see the doctor, and I think we should end it with constantly go for checks. Yes. Constantly go to the hospital. Do not overlook anything. If something happens, do not self-medicate. Go to the hospital and get professional advice and from the doctor. Yeah. Thank you so much for coming. We have to go on a break. Coming up at 12 o'clock is the world news, and right after that, the